All right. Hi, everybody. My name is Abigail Andrews, and I am an energy analyst on the sustainability team at NYCHA, or the New York City Housing Authority. NYCHA is the largest public housing authority in North America. And here in New York, we serve 1 in 16 New Yorkers across approximately 2,400 buildings. And that's through a combination of traditional public housing, of RAD PACT programs, and through Section 8 vouchers. At NYCHA, we're very focused on providing quality and sustainable housing to our residents, as well as connecting our residents through opportunities within our campuses and across the city. This year, NYCHA has 5 pitches to bring to the table to ensure that our residents are supported. I'm excited to talk about sustainability's work in innovation and compliance with climate goals. And then I will pass the mic to my colleagues in residential health initiatives that work to advance health equity. And where is the, sorry about that. So due to the sheer scale of NYCHA, the integration of sustainability into our portfolio is essential to meet the city's climate goals. And our team is committed to piloting innovative technologies to do just this. And we recently released, and if you haven't had the chance to read it, please do, the 2026 Sustainability Agenda. The 2026 Sustainability Agenda has pledged to install heat pumps in 20,000 apartments and induction stoves in 10,000 apartments. And this is a major, major step towards electrification and decarbonization. However, these new systems will require new electrical loads. And the average NYCHA building was built in the 40s, 50s, and 60s, and therefore may not be able to support these electric loads. And these projects could become cost prohibitive. So NYCHA is exploring the possibility of in-unit batteries that could defer the cost of upgrading our electrical infrastructure. These in-unit batteries, they may smooth peak demand, they may buffer new loads, and they'll allow us to work within our existing electrical capacity. So our project is aiming to answer the question, to what extent can in-unit batteries defer or eliminate electrical service upgrades, and under what conditions and in what building typologies is this most cost effective? So we're looking for an expert in energy economics or building systems who can quantify the life cycle costs of in-unit batteries and help us provide a ranked list of developments to prioritize our work. So if you are that person, looking forward to connecting with you during networking or after this. Thank you so much.
Hi, I'm Stefan, a public health advocate and a person with lived experience receiving mental health services and supports for about 3 decades. And my work has brought me to NYCHA for a third time to lead community mental health. And in this amazing year of working with internal and external partners to build out our community mental health infrastructure, I thought it prudent to build out our evaluation framework. So a little bit about our program. Our NYCHA Mental Health Task Force is the heartbeat of our work. It's comprised of, most importantly, NYCHA residents and public health advocates like myself from various sectors. We have convened a citywide community mental health summit at the end of last year and community mental health days this year in Brooklyn, one coming up in the Bronx, and hopefully in all of the boroughs for all of the years moving forward. 80% of our program participants said that they would be extremely likely to participate in our programs again. They said that they feel more adept in addressing mental health crises in their communities, and we are so incredibly proud of this. But now it's time for us to do the deeper work to get the most precise representation of the mental health needs of our residents. Our family partnerships folks told us that in 2025 alone, they made over 1,000 referrals for residents who were seeking supports related to mental health. So with this, The pitch is this: we need folks on our team to elevate our level of research and evaluation and analysis of that research so that we can continue to program our convenings and our conversations from a data and lived experience lens. Thank you so much.
Good afternoon, everyone. Happy Friday Eve before a holiday weekend. All right, let's get the energy up. So I'm Geraldine. I'm a healthcare partnership manager for resident health initiatives. I like acronyms. I've changed our department name to really hot and innovative. So I'm here today to pitch designing a health employer collaborative for career pathways. So we have found a number of NYCHA residents have really demonstrated a strong interest in health, public health in the last several years, and made available trainings in allied health, community health worker training, and then also an opportunity to serve an AmeriCorps program, the NYCHA Health Corps, which is solely recruited NYCHA residents to explore the career pathways in public health or preventative health. So what's happened, they're really getting an opportunity to see how they can impact health of their communities that often experiencing challenges. What has also happened is that they've post training and service that there's still a need to make that connection. So there's a missing puzzle piece. There's an opportunity to close the loop, and I think this is a solution. So what we're looking to do is create a collaborative of public and private health employer partners that would come together and really provide a enhanced pathway to getting people through a training to an actual full-time, long-term employment opportunity. So with this career pathway being enhanced, it's more exposure to internships, AmeriCorps placements with employers that can potentially hire them after their service, or just a basic job opportunity that would suit them as an entry level to kind of bring them forward into exploring what real economic mobility is. And so the ask is for someone or a partner that is creative, that is really entrenched in workforce development and really wants to make that commitment to kind of see how we can all work together, design interventions that can kind of create the opportunity for certainty for employment. So once again, thank you for the time to pitch. Wishing you a happy holiday weekend. And it's a plus if you're interested in creating great acronyms. Thank you.
Good afternoon, everyone. My name is Natasha Dice, and I'm a senior project manager and Healthy Start at NYCHA within Resident Health Initiatives. Healthy Start at NYCHA was created to help address maternal and infant health inequities impacting families living in public housing communities across New York City. Many expectant NYCHA families face environmental hazards such as mold, leaks, pests, and other unsafe housing conditions that can negatively impact pregnancy and birth outcomes. Families also often need stronger connections to maternal health services, infant resources, childcare support, and fatherhood initiatives. Our program works to bridge those gaps through wellness outreach, resource navigation, hazard remediation advocacy, and community partnerships that support healthier homes and healthier families. We proactively identify housing-related hazards while connecting residents to critical maternal, infant, and father-friendly support services. Through wellness calls, citywide baby showers, as you can see on the photo, that's a big, we're known for our citywide baby showers. Healthy Start continues expanding access to resource for growing families across New York City. Our Pitchfest proposal focuses on strengthening service delivery through improved workflows, data collection, outreach coordination, and hazard remediation tracking to better support expectant NYCHA families. With enhanced support and strategic collaboration, Healthy Start can continue advancing maternal health equity, strengthening fatherhood engagement, and creating healthier futures for NYCHA families citywide. Thank you, Pitchfest, for this wonderful opportunity today, and thank you all for listening, and I hope we can work together in the future. Thank you.